Actually, Rush has just mentioned there are lots of different treatment options available. We tend to look more at the conservative side of things. Lots are evidence-based and some aren't evidence-based, but there's also common sense that comes with treatment plans. So I'm going to go to Rupen first and say, how many people respond well to conservative treatment with you, and how often do you use a clavicle brace?
So if we talk about shoulder pain as such, I'd say the majority, 80 to 85% of patients respond to conservative measures. So I'm sure Dan would agree, most people who walk into our clinic don't need an operation. And sometimes there's this sort of misconception that you're going to go and see an orthopedic surgeon, so the first thing they're going to do is offer you surgery. But our sort of job essentially is to diagnose what may be driving that particular problem. And then, recommend sort of conservative measures, and if they have not had physiotherapy or not seen a sort of shoulder physiotherapist, see one of them. And the other thing is obviously, if pain's a barrier, then quite often they respond to a sort of a steroid injection. And the steroid injections, it's not there. It's not, this function is not to alleviate the pain forever. It's there to give you temporary pain relief so that you can then strengthen the shoulder through physiotherapy. There's lots of evidence to show that the steroid will only last for 6 to 8 weeks maximum. Occasionally people require repeated injection. It's purely for pain relief, so to facilitate therapy. So I'm quite clear in telling my patients that this injection is not there to cure you, it's to try and give you pain relief so that you can then rehab your shoulder. And then it's only 10 to 15% of people who, for one reason or another, do not respond to those measures, or have a temporary improvement and then their symptoms regress again, who may then benefit from surgery. So that, I think the answer to your question is the majority of patients are treated non-operatively.